Now, if you're only missing one tooth, why a dental implant over a traditional bridge?
So the best way to replace a single missing tooth is to just replace that single missing tooth. With a bridge, you have to grind down the two adjacent teeth that are next to that missing tooth. And whenever you grind down an otherwise healthy tooth, you're asking for trouble down the road. It may not be for a year, a few years, 5, 6 years, but eventually there might be some decay around that bridge. And now you're looking at replacing that bridge, grinding down more teeth. So it's kind of a snowball that happens once you start grinding down otherwise healthy teeth.
Okay.
The other option we have is a dental implant, where instead of touching the other teeth, we leave them completely alone, and we simply put a little titanium screw into where that missing tooth is, and you get a crown or a tooth right on top of that dental implant. And now you've basically essentially replaced that single missing tooth without harming anything else in your jaw.
Okay, then what about cost? I mean, in the long run, what's less, the implant or the bridge?
So it's relatively the same initially, but long term the implant wins out. The reason is, once that bridge starts failing, you're going to have to do something else. You're going to have to either take those teeth out or make a bigger bridge. And that bigger bridge is going to cost you more than that initial bridge that you had placed. So long term, the dental implant's definitely a better solution.
If one of your family members just needed one tooth, would you always go a dental implant over a bridge?
I would, and I've done it.
Okay.
I've done it on family members where they had the option of a bridge versus a dental implant. And I told them, look, we have to do a dental implant. It's better for you in the short term and the long term.